Well, hello, this is Dr. James Williams, and over the next 14 to 16 slides, I would like to present to you the anatomy of the oral cavity. As you can tell from the photographs I posted on the first page, you will be interested in knowing something about the oral cavity as you examine your patients. That may be the first sign of disease where you will pick up perhaps oral infections on the tongue cancers, tonsillitis, or a stone in one of the salivary glands. I want to put this in perspective for you first by taking the sphenoid bone. This is an anterior view, and the yellow shaded area is the anterior surface of the pterygopalatine fossa. These red circles relate to the position of the infratemporal fossa. You've already looked at this to find the pterygoid muscles and the maxillary artery and its branches, as well as numerous nerves. These blue circles relate to the position of the sphenopalatine foramen as we get closer to the center of the face. Let's put the external carotid artery in for perspective to show you where it terminates in the superficial temporal artery and maxillary artery, passing through the infratemporal fossa. This artery passes through the pterygomaxillary fissure to reach the pterygopalatine fossa. Let's take a closer look at the perspective I really want you to have here. Now we have a nasal cavity with a centered nasal septum, a palate, and three sets of turbinate bones, also called concha. And so I'm very happy that we have some perspective here as to where we are headed with our review of the oral cavity. So let's take a look at some of the general features of the oral cavity. We have a hard palate. We have the beginning of the soft palate and two arches that are named for their connections. The palatoglossal arch, reaching from the palate to the tongue, and the palatopharyngeal arch, reaching from the palate to the pharynx. In between these two arches, you will find the palatine tonsil. And then we have that funny looking midline structure that we usually call the hanging down thing, but it's really called the uvula. And it really has its own muscle. You will come to use this part of the anatomy in your neurologic exams of cranial nerves. If we lift up the tongue, we can see a midline structure called the frenulum. On either side, in a living person, you can see the deep lingual veins that are exposed beneath the mucosal surface. And then we have two salivary glands. You can see the openings, and there are several, for the sublingual ducts, and then the submandibular duct, along with where I've starred the respective glands. The sublingual gland is largely mucus with several ducts. The submandibular gland is seromucus, and it's that famous gland that causes you to squirt saliva out of your mouth as you're in the dentist chair and he asks you to open wider and all of a sudden you nail him in the eye. It's coming from that gland. Let's take a quick look at the roof of the hard palate and other structures. We have palatine processes that form the hard palate, and you will learn about this in your embryology series on the head and neck. There's an opening anteriorly called the incisive fossa, which transmits the greater palatine artery and vein and the nasopalatine nerve. Toward the back, we have a foramen that transmits the descending palatine vessels and greater palatine nerve. And just posterior to that is a smaller foramen, the lesser palatine foramen, which will transmit the lesser palatine vessels and nerve. There's not much to consider here with the walls other than the buccinator muscle. Overlying that are some of the muscles of facial expression. What I want you to understand is that motor innervation is via the buccal branch of the facial nerve, and the general sensation from the skin and the oral mucosa of the cheeks is carried by the buccal branch of the trigeminal nerve. So you have two buccal branches to think about. It's just their relationship to the cranial nerve that matters, as one will be motor innervation and the other will be general sensation. It's important to understand a few things about the tongue. The root of the tongue is attached to the mandible and the hyoid bone. And we have an anterior 2/3 of the tongue that is called the oral part of the tongue, and a posterior 1/3 referred to as the pharyngeal part of the tongue. And they are separated by a V-shaped terminal sulcus where the foramen cecum is located. It's a midline structure, and it marks the site of the formation of the thyroid gland. There are muscles in the tongue, and the bulk of the tongue is composed of muscle, and I will cover those in a bit. And then lying between the tongue are the geniohyoid and mylohyoid muscles. So let's take a look at the tongue from behind. And as you'll see in this diagram, that we have 4 intrinsic muscles. They actually have names, but I want you to just think of these as a group of intrinsic muscles. You can tell by their names the direction that they would pull fibers, and that accounts for a lot of the different contortions that your tongue can have as you're singing or chewing food. All of these muscles are innervated by cranial nerve 12. Again, learn these muscles as a group of intrinsic muscles. There are 4 extrinsic muscles. This means that they originate from outside the tongue and insert into the tongue. The first of these is the genioglossus. The second on the side of the tongue is the hyoglossus. And the third is the styloglossus. All 3 of these are innervated by cranial nerve 12. The palatoglossus is innervated by cranial nerve 10. Now I put this figure in from Drake just to show you. I think it's a neat figure showing the tongue and how it's impacted by the extrinsic muscles of the tongue, and also how this interacts with the tensor and levator veli palatini muscles of the palate. This is important to consider in that complex process referred to as swallowing. It's not just an easy thing to do. It requires a lot of coordination. And with certain cranial nerve lesions, you will run across people that have difficulty in swallowing because of lack of innervation or an imbalance of these muscles. Finally, let's take a look at the tongue from behind. I've actually removed the tongue here to show you the other 2 muscles that lie deep to the tongue. One is the mylohyoid. It's a muscular diaphragm swinging from one side of the mandible to the other. It has a free posterior edge. It's innervated by a branch of the trigeminal nerve 3rd division. It's like a hammock. And sitting on top of that is the geniohyoid, and it looks like a person lying in a hammock. It's innervated by a cervical branch that hitchhikes along the hypoglossal nerve. Just think of me lying in a hammock when you think of this arrangement. And if I ever get my way, I think I'm going to change its name to gemiohyoid. The vascular supply of the oral cavity can be a bit daunting, but there's some principles that you need to understand here, and that's the principle of overlapping distribution and collateral circulation. Each of these four arteries that I'm going to put up here for you will have branches, but I want you focused on the four arteries. The lingual artery, it has dorsal and deep lingual branches. The maxillary artery, it has greater and lesser palatine branches. The facial artery with ascending palatine branch. And finally, the ascending pharyngeal artery with its own palatine branch. And as you dissect these, you will find numerous small branches. I want you focused on the four main arteries here. Innervation of the tongue and oral cavity is important, and here we have three nerves to consider. First is the trigeminal nerve, cranial nerve 5, and the general sensory innervation that occurs. For the upper parts of the oral cavity and palate and upper teeth, we have the second division of the trigeminal nerve. But below the oral fissure is where we find the lower parts of the oral cavity, the lower teeth and anterior 2/3 of the tongue, and this is supplied with general sensory information by the third branch of the trigeminal nerve. Secondly, we have the facial nerve, cranial nerve 7. This provides taste to the anterior 2/3 of the tongue. So we can summarize this as general sensation is coming to us via the lingual nerve, which is part of the third division of the trigeminal nerve. Special sensation, which is taste, comes from the facial nerve via the chorda tympani, which you have found in the infratemporal fossa. But please note that the chorda tympani extends over to the lingual nerve and rides the lingual nerve as a hitchhiker to get to this part of the tongue. And then finally we have the glossopharyngeal nerve, cranial nerve 9. It provides general sensory information for the posterior 1/3 of the tongue and special sensation of taste as well. And there we have it for sensory innervation of the oral cavity and tongue. Now we have three nerves to consider with respect to motor information to the oral cavity and tongue. Again, we have the trigeminal nerve, cranial nerve 5, which provides motor innervation to the tensor veli palatini and mylohyoid muscles. We have the vagus nerve, cranial nerve 10. It provides motor supply for all the muscles of the soft palate and palatoglossus except the tensor veli palatini. And finally, the hypoglossal nerve, cranial nerve 12, which provides motor innervation for all muscles of the tongue except the palatoglossus. And here I've illustrated it in the diagrams for you. Before we take up another important feature of innervation of the oral cavity, let's review the three salivary glands. These are paired glands for the oral cavity. The first and the largest is the parotid gland. You have already dissected this, maybe you've removed it, and you've seen the duct that passes across the masseter muscle and penetrates the buccinator muscle. It opens into the oral cavity adjacent to the crown of the second upper molar tooth, and if you take your tongue and push laterally into your cheek, you can feel what feels almost like a cut, which is where the duct has opened. It's important to consider that the parotid gland encloses the external carotid artery, the retromandibular vein, and part of the facial nerve, number 7. Any swelling of the parotid gland, such as in mumps or an infection, or even a benign tumor that grows, will compress these three structures. it's not such a problem for the artery and the vein, as collateral circulation can backfill these areas and drain them. But crushing the facial nerve is not such a benign problem, as you will lose this nerve and its functions. The parotid gland is largely a serous secreting organ. Next, we have the submandibular glands. They are these hook-shaped glands that you probably noticed when you did your neck dissection. Many of them get cut in the process because we don't know to look for them at that point. The duct is an opening beside the base of the frenulum of the tongue anteriorly. And there's an important relationship to use, and that is that the lingual nerve loops under this submandibular duct. Here we have it, the submandibular gland and the submandibular duct. And then finally, we have the mucus-secreting sublingual glands. They're the smallest of the three paired salivary glands. They lie lateral to the submandibular duct and the lingual nerve, and they have 2 to 3, maybe even more openings as they ooze mucus into the floor of the oral cavity. Here we have the gland and then its associated ducts. I want to move on now to the parasympathetic innervation to oral cavity glands. We want to take up first the innervation of the parotid gland. Preganglionic fibers from the glossopharyngeal nerve pass through the tympanic plexus, which you can see is a purple circle with little purple squiggly lines in it. After it passes through here, the autonomic fibers emerge as the lesser petrosal nerve. This nerve then passes through the foramen ovale to synapse in the otic ganglion. From this point, postganglionic fibers join the auriculotemporal nerve, which is a branch of the third division of the trigeminal nerve, to reach the parotid gland. Next, we have the glands above the level of the oral fissure. In this innervation pattern, we have preganglionic fibers from cranial nerve 7 that travel as the greater petrosal nerve, and they join the deep petrosal nerve, which is sympathetic, to form the nerve of the pterygoid canal. After passing through the canal, the preganglionic fibers will synapse in the pterygopalatine ganglion, with postganglionic fibers traveling in branches of the second division of the trigeminal nerve to reach their target organs. Here we have the greater petrosal nerve, the nerve of the pterygoid canal, which has parasympathetic and sympathetic components, the pterygopalatine ganglion. Now let's consider the last of these, and those are glands that are below the level of the oral fissure. Again, we have cranial nerve 7 involved. These preganglionic fibers travel as the chordotympani nerve and join the lingual nerve, which is a branch of the third division of the trigeminal nerve. After hitchhiking on the lingual nerve fibers, the preganglionic fibers of nerve 7 synapse in the submandibular ganglion. Postganglionic fibers pass directly to the submandibular and sublingual glands, while others travel with the lingual nerve to smaller glands in the region. Here we have the chordotympani passing over to the lingual nerve, synapsing then in the submandibular ganglion, and innervating the submandibular and sublingual glands. But do realize that even though we have these 3 paired salivary glands, we have a lot of seromucus secretions in and under the mucosal surface of the oral cavity. And probably the best way of illustrating this, and it's a little gross, is that if you can remember the last time you were nauseous and were about to vomit, that there was a flash of serous secretions into your oral cavity from all of these glands. This serves to protect your oral cavity from the acid contents of your stomach should you vomit, actually. Well, on that cheery note, let's just review that we have summary points here. I've covered general features, the tongue, the vascular supply of the oral cavity, its innervation, and the salivary glands. I certainly hope this helps you in your study of anatomy and the process of becoming a physician. Thank you.